So at Institute for Healthcare Improvement, we are so privileged to be able to work alongside East London Foundation Trust to support you in the triple aim work that you're pursuing. And of course, by triple aim, we refer to keeping in balance three aims simultaneously: improving the health outcomes for populations, improving the care delivery and care experience for patients, and improving value. And those three things we want to pursue simultaneously because they all impact each other. And so we want to think about the best outcomes for populations that you serve. Now together, East London Foundation Trust has also put an emphasis on the well-being and the experience of their staff as well as a key contributor to getting to those outcomes. So Catherine, do you want to talk a little bit about the work we've done in the past couple of days to help support the triple aim work here at ELFT?
Sure. So it's been really exciting. We've been able to learn alongside different communities where the triple aim work is taking shape locally. So in one of those, the Tower Hamlets Together work, there's three different populations of focus, and one is children who have asthma or respiratory illnesses, another are women of reproductive age, and another are folks with complex conditions, often at the end of their lifespan. And so there we've been able to help the teams to get specific around their target populations and look forward to how they can redesign the care systems to be able to support triple aim outcomes. In Bedfordshire, there's new opportunities taking shape there, also around implementing the triple aim locally. So very exciting stuff.
And simultaneously, as we were working together with community partners, we also had an opportunity to bring together some leaders across ELFT and really help them think about how they could bring triple aim thinking to the populations that they serve directly. And so in that work, we were able to work with several different leaders and be side by side with them as they thought through, how do we understand better the current populations that we serve? What matters most to those people and those groups of people that we serve? How might we measure that and understand those metrics? What are the different factors that influence getting to better outcomes for those patients? And who else might we need to partner with to improve outcomes for those patients?
So all in all, there's just so much exciting work happening where we're going to be able to walk alongside the East London Foundation Trust in their learning journey to see how things unfold and change within the trust itself and also within the communities that they serve. So yeah, really pleased to be here.
All in service of the new mission. So congratulations and thanks for allowing us to participate.